Hello and welcome to another episode of your AKT Podcast. Thank you so much for being a valued listener of this podcast. And for the upcoming episodes, we have considered the suggestions that you have emailed in regarding what type of podcast episodes you'd like to hear from us. Now, the first podcast today is going to be around fit testing, and we have two cases to share with you. And what I'd like you guys to do is consider which of the following cases would require a fit test. So the first option is a 63-year-old patient with anemia but normal iron studies. And the second option is a 50-year-old patient with rectal bleeding. Now this case is going to test our understanding of two concepts. What is a fit test and our application of the NICE NG12 guidance. Now, firstly, we can answer this question by purely covering a definition of fit testing. So fit testing is fecal immunochemical testing, which is a test that looks for blood in a sample of poo. It looks for tiny traces of blood that you might not be able to see with the naked eye, which could be a suggestion of cancer, but we appreciate that there's other causes of PR bleeding as well. So without even looking at the NG12 guidance, we have a patient who has quite frank bleeding in option 2. So therefore, you know that option 1 is going to be the answer because you have a 63-year-old patient with anemia, but they have no mention of bleeding. So therefore, the fit testing is going to be most useful in a patient who is not having bleeding. Now, the second part of this question, as we discussed, was around NG12 guidance. If you haven't looked at the NG12 guidance, please do this regularly as the guidance is continually being updated. So in addition to the 2-week wait rules that we should already be aware of, we should also be aware that fit testing can be offered in patients who are over the age of 50 that have either unexplained abdominal pain or unexplained weight loss. Now, if people have a combination of these symptoms, i.e. abdominal pain and weight loss, then we know that we have to refer them on a 2-week wait. Now, the second part of the fit testing guidance is around patients who are under the age of 60. So that is for patients who have either a change in their bowel habit or an iron deficiency anemia. So if you have a patient who's under the age of 60 with either one of those symptoms or signs, then you will refer them for a fit test. If they were over the age of 60 with those features, then it would be an automatic 2-week wait referral. And finally, for over the age of 60, i.e. our case that we had, the 63-year-old patient, then we know that if you are aged over 60 and you have an anemia, even in the absence of iron deficiency, then you should be offered a fit test. I hope you found that helpful. I hope you join us for the next podcast. And if this is the first time listening to this podcast, do go back and listen to our previous episodes and always continually check out primary guidance because that's the best way to revise for the AKT. This podcast is hosted by wellmedic.co.uk. We help GP trainees pass the AKT.